Hello everyone, welcome to Tech Sharmit. In this session, we will discuss about another few medical related terminology, prefixes that is used to denote physical property or shape. Okay, so whenever you want to showcase something as physical property or shape, then in that case you can utilize the medical terminology prefixes. Okay, which we are going to discuss in this session. So let's say I'm assuming that you are referring the session directly from this particular part, and maybe you have not covered the previous session. So just for them, like I'm repeating one thing, like prefix, the definition of prefix. So prefix is something which is used in order to attach at the initial part of the medical terminology, and that produces some sound. Okay, some thing that denotes like physical property. It could be shape. It could be direction, position, movement. Okay, so to showcase those things, we will use the prefix. Okay, so yeah, this is all about the prefix. Now, how we will learn about the prefix in this session? First of all, I'll tell you about the prefixes with their actual meaning, and to make it more clear to you, so that you can prepare it for the exams, medical related exams and interviews. I'll show you some examples as well, so that it will help you to identify. Okay, yeah, this is the purpose through which for which we can utilize these prefixes. Okay. So let's start with the first prefix. The first prefix is reticulo. Now, what is reticulo? A reticulo is something that is used to produce a sound of net, or you can say network like structure. So, whenever you want to showcase something as network or network like structure, then in that case, we will utilize the terminology reticulos. Okay, reticulo. Okay, so let's look at the first example. First example is reticulose, which is a substance with a net-like appearance. Okay, whenever you want to showcase something as a substance with a net-like appearance, then we will use the example reticulose. Got it? Then we have reticular activating system. Now, what is reticular activating system? It is a network of neurons in the brainstem that plays a role in regulating wakefulness and sleep-wake transitions. A network of neurons in the brain that plays a role in regulating wakefulness and sleep wake transitions. So again, you can see here we are again referring the term which is related to the networks or net. Okay, fine. Then we have another example as reticular formation. Now, what is reticular formation? Reticular formation is a you can say it is a network of nerve cells in the brainstem involved in various physiology functions. Okay, so again you can see here we are talking about the nerve cells, network of nerve cells which is in brainstem involved in the various physiological functions. So again, to showcase something as network like structure or to showcase something as net like appearance, we are using the terminology reticulo. The actual terminology is reticular formation and the prefix is reticulo. Then we have reticulo nodular. Reticulo nodular. Now, what is reticulo nodular? It is this is a structure having it is having a net-like appearance with nodules. So when there is a combination of nodules and net-like appearance, then in that case we will utilize the terminology reticulonodular, where reticulo is a prefix. Okay. Now, if you look at all these examples again, you will find that yes, there is something common in between them, which is network or net-like appearance. So that's the reason we are using the terminology prefix as reticulo. So reticulo is a prefix and other thing is a terminology. Like reticular activating system is a complete terminology which is composed with a reticulo prefix. Then we have next prefix as scolio. Scolio. Now what is scolio? Scolio is a prefix that is used to showcase something as twisted. So when you want to showcase something as twisted, then in that case we will use the prefix scolio. First example, scolioma. What is scolioma? Scolioma, it is a tumor-like mass of twisted tissue, often associated with a scoliosis. Okay, so here you can see it is composed with a tumor-like mass of twisted tissue, mass of twisted tissues. So you can see it is producing a sound of twisted of tissues, twisted of something. Okay, then we have scolioraches. Now, what is scolioraches? A condition involving in twisting or bending of a spinal cord. So just assume a scenario where the spinal cord is bent or you can say twisted, then such type of condition we will refer with the terminology scolioraches, which is composed with the prefix scolio. Okay. The next example we have is scoliotrophin. Now, what is scoliotrophin? A substance influencing the growth and the development of scoliotic structure. A substance influencing the growth and development of scoliotic structure. Then such type of substance is defined with the terminology scoliotrophin, where scolio is the prefix which is showing something as twisted. Because again we are talking about the scoliotic structure. Scoliotic means something is twisted there, right? So that's why we are using the prefix scolio. Then we have scoliometer. By the name you can easily identify it is used to something for the measurement purpose, right? Scoliometer. Now what is the scoliometer? An instrument used to measure the degree of curvature in scoliosis. An instrument used to measure the degree of curvature in scoliosis. So let's say someone is measuring the curvature of scoliosis disease, or this, you know, the scoliosis means, right? Twisted of a mass, and it could be related to the spinal cord. Yes. Okay. So that is spinal cord curvature is measured with the help of one instrument which is known as scoliometer. Okay. So yeah, these are the some example which is used in order to showcase something as twisted. So far we have covered two prefixes. First is reticulo, second one is scolio. Okay. Now we will discuss about the another prefix which is thermo, and I guess it is you will feel that yes, this is something that you have already heard about thermo. Maybe you have learned about the thermodynamic subject, or like it is most popular term in medical science as well, right? So what is thermo? Thermo is something which is used to in showcase something related to the heat. It is something related to the heat. Okay, so let's see the example so that it will clear more picture. It will clear the picture. So first example is thermogenesis. Now what is thermogenesis? Thermogenesis is the process of heat production in the body. Okay, so whenever the body start producing the heat, then such type of process is known as thermogenesis, because body is producing heat, and again we are using the thermo in order to showcase something as heat. Then we have thermogram. Now what is thermogram? An image or record showing variations in temperature. Whenever a record or image is used to showcase the variation in temperature, often used in medical imaging, then this type of imaging or record is known as thermogram. Okay, so let's say if someone suggests, a doctor suggests that medical imaging, which doctor is referring for identifying the variation in the temperature, then in that case we will use the terminology thermogram. Likewise, we have another example which is thermometry. Now what is thermometry? The measurement of the temperature. It is quite simple. Thermometry means measurement of the temperature, which is again related to the heat. Then we have thermoregulation. What is thermoregulation? The process of maintaining a stable internal body temperature. The process of maintaining stable internal body temperature is known as thermoregulation. Got it? So yeah, now if you walk through all these examples again, you will find that yes, there is only one common thing, which is heat, which is used to which is denoted with the help of prefix thermo. So yeah, these are the three prefixes which I would like to share with you all in this session. In the next session, we will cover few more things. And for today, like we have one question: what information is provided by the prefix kaifo and photo. So I know that if you know about this answer, then I request you to put the answer in the comment section so that other can take a reference from it. Otherwise, if you are facing any issue in this question, then I would suggest you to go and check out the previous session so that uh, it will help you to clear your concepts. Okay. So yeah, that's all for today. In the next session, we will discuss few more things. So thank you for watching Texture Myth.